Hello, you are going to be having surgery soon. In this slideshow, we will be discussing surgery and more specifically, shoulder arthroscopy. Let's start with some shoulder anatomy. Remember that the rotator cuff is a group of 4 muscles deep inside the shoulder. They attach to the humerus and are responsible for actions such as reaching forward or to the side. Deep inside the shoulder, the glenoid labrum surrounds the socket in a ring-like structure. The labrum provides some stability for the shoulder. The long head of the biceps tendon inserts on the labrum and sits in a groove on the front of the humerus. Many shoulder arthroscopies will involve repairing the rotator cuff. If you have a rotator cuff tear, one of the goals of surgery will be to repair this tendon back down to the bone. As you can see in the top left corner, a tear in the supraspinatus is the most common location for a tear. Rotator cuff tears are common. They are mostly degenerative in nature and generally involve pain and loss of function. We also know that rotator cuff tears do not heal on their own, and they usually get larger over time, which is usually associated with an increase in pain. If you have a known rotator cuff tear, the goal of surgery will be to heal the tendon back down to the bone. The surgery is arthroscopic, meaning performed with a camera. Outpatient means you come in and go home the same day. And small to medium-sized tears have an excellent chance of improvement. Things that may make repair more difficult include smoking, having uncontrolled diabetes, a large or massive sized tear or recurrent tear, or multiple steroid injections. You will be completely asleep for the surgery and lying on your side. We will start by making small incisions on the outside of the shoulder. Then your shoulder will be filled with water and we will put a camera inside to look at the shoulder joint and many of the soft tissue structures. If you do have a rotator cuff tear, we will begin to repair it by placing biodegradable anchors into the humerus bone. These anchors have sutures attached that will be passed through the rotator cuff tendon and used to secure the rotator cuff back down to the bone. You will have nylon sutures closing your incisions. These will be removed at your first post-op appointment. A large white bandage will cover your shoulder. This may be removed on post-op day 2, and then you may shower. You can get the incisions wet, but do not scrub or scratch at the incisions. You may have already been contacted about obtaining a sling after surgery. We want you to wear the sling throughout the day and at night while you're sleeping. At your first post-op appointment, we will teach you how to stretch your elbow and how to let your shoulder dangle in front of you in something that we call pendulums. Most patients say that it was best to sleep in a recliner following surgery. If you prefer to sleep in bed, you may do so. Just choose whatever is more comfortable. Our patients will receive a nerve block prior to their surgery for pain control. This is where the anesthesiologist performs a procedure to make your shoulder numb. This lasts about 24 hours, and when the numbing medication wears off, you will get a tingling sensation in your hand. This is when we recommend you start taking pain medication. Oxycodone or hydrocodone may be used, and we will discuss this in more depth at your pre-op appointment. We will also prescribe an antibiotic to be taken after surgery to prevent infection. This will be cephalexin unless you have an allergy to this medication. A prescription for these will be written at your pre-op appointment. We also recommend ibuprofen and Tylenol to be taken in addition to narcotic medication. If you have a rotator cuff repair, you will be in a sling for 6 weeks following surgery. If you do not have a rotator cuff repair during surgery, you will be in a sling for about 1 to 3 weeks, directed by your surgeon. Once you are told by your provider that you will no longer need the sling, we will begin stretching exercises. We will teach you these stretches in our office and eventually send most patients to outpatient physical therapy. You may not lift anything more than a couple of pounds or a full cup of coffee away from your body during this time. Lifting close to your body is allowed. We will discuss this in more detail at your post-op visit. Around 3 months from surgery, most people are back to their normal daily activities, but we ask that you do not lift anything heavy away from your body. Complications of surgery are listed below. There are always risks of surgery. However, with arthroscopy, these risks are diminished significantly. Anesthesia comes with its own set of risks. Your anesthesiologist will discuss these with you. We will discuss your medication and allergy list at your preoperative appointment. If you were told to do so by our office, you may need to get lab work, possibly COVID testing, clearance by your primary care provider, and possibly an EKG. After your surgery, we will be following you closely for many postoperative appointments. Most of these will be to check your range of motion and to give you more exercises for your shoulder. Thank you for listening. If you have any further questions, please write them down and we will discuss them at your pre-op appointment.